I'm Beth Shibley, and this is Sunflower House's workshop, Caregiver 101 workshop. And this is, I think this, which one was this one? This one is Caregiving 101. I forget the getting started. I forget the name of this session, and I apologize. In any case, with me today is Ali Almejian from Aging Matters in Brevard, the organization I work with, and also Kara, your last name? Anderson, from Simplifying Senior Living, right? And Deborah's joining us from the community, and we're here today to just start to talk about the basics of caregiving. So, Kara and Allie, Kara, would you like to? Oh, Allie, would you like to start, and then Kara with a little bit of a introduction as to who you are, more than what I've already said.
Sure. So my name is Ali Almejian. I am the Home and Community-Based Services Program Director. So at Aging Matters in Brevard, basically my job is to oversee, there's several different service lines that's under me. One of them is the Sunflower House and the caregiver support, community caregiver support program, as well as some in-home services. We help with safety home modifications and our transportation. So I kind of oversee several different service lines under Aging Matters in Brevard. I've been with the company for a little over 3 years now, background in social work, and it is a pleasure to be here. So thanks for having me.
Thank you so much. Kara, would you like to tell us a little bit about yourself?
Sure. My name is Kara Anderson, and I'm the owner of Simplifying Senior Living. And I help folks find assisted living, independent living, or memory care throughout Brevard County, depending on their care needs and their budget. I kind of narrow down all the options across the county and present them in a way that the family can manage, because it's a lot of information. It's a lot of kind of things to know. So I utilize my 25 years of experience in senior living to help the families really focus on the options that are applicable to them. So they're not wasting a whole lot of time running around, because it's usually during crisis time that they're trying to come up with some living options.
Thanks, Kara. Deborah, would you like to tell us a little bit about your situation and why you're joining us today? I caught a little bit of it in your email, but what's going on in your life?
Well, my name's Deborah, and my dad is he's in rehab right now at Vieira Del Mar, and he's declining after a fall. He could live by himself prior to the fall, and now he's declining physically and cognitively. But I've made a decision. I live in Pembroke Pines, and I've been at his house paying his bills and trying to take care of him, visits and everything, and bring him stuff. And we've determined that we want to bring him home. And they were thinking of discharging him anyway on the 16th, because he's reached a plateau as far as physical therapy. And so I need to learn as much as I can about bringing a 90-year-old father home who is going to be he went from self-supporting to he will now be completely dependent.
Yeah, and I think this is exactly the workshop for you, because that's where we're really looking for folks who had a really just a distant understanding of what caregiving, caregiving for somebody really meant, to then all of a sudden being kind of dumped into the deep end of the pool. And that's what I think it can feel like when all of a sudden, because my mom is also really independent. She's a little younger than your dad. She's in her early 80s. But I'm looking and, but I'm also thinking that same sort of thing. If I didn't know what I know, how would I learn it? And it often happens that exactly the way you're saying, Deborah, it's just, we're kind of pushed into the deep end of the pool. So Allie is going to start out and talk a little bit about sort of sort of like what the world of taking care of somebody in your own home, Allie. So
Mhm.
did you have you don't have a PowerPoint, do you, Allie?
I don't. It's all in my noggin.
Oh,
So kind of stroll from there, and know, Deborah, as well, that we'll make sure that you have our contact information and it's put up there. So feel free to always reach out to us any manner, anyhow, phone, email, whatever is really easier for you, and we'll kind of help guide you, because we're going to give a lot of information today and it can be a little bit overwhelming, but we're just going to throw it out there and then take with what you can, and let us know what we can help kind of narrow down for you and make it easier.
Thank you.
Yeah, absolutely.
I
Absolutely.
mean, those are great words of support. Thank you.
Yes, sure. Kind of being in the home is a different scenario than others. I mean, you've got different options, you've got ways and avenues that you can go through. Aging Matters' primary goal is to keep our seniors in the homes and to have them age in place. Of course, safely is the best word that we can put, because not everyone can age in home, and that's what Kara will jump into as well, is not every person can age in home, but what are the services that there are? What are the services out there to be able to help your parent or loved one age at home? And really, I kind of wanted to go through the different definitions and the different services that can be in the home, and possibly, we'll go through payment options, and we'll get to all of that to different ways of going through these services and how to pay for them. But really, the in-home care is just that. It's in-home services that helps your loved one be able to age in place. I'm going to go through them in definitions. You have a homemaker. A homemaker is someone who is doing light housekeeping. They provide some meal preparation, they can provide some linens, changing sheets, doing laundry, they can go shopping for them. Really, it's that safety in the home to make sure that they're okay in a safe environment, going through the refrigerator for spoiled foods, quite possibly. Just that overall, making sure that the home is a safe environment. It's not the baseboards and the fans as much as it is the clean sheets and shopping and meal preparation. So that's kind of the homemaker. There's also personal care. Personal care is your bathing and your grooming, helping someone who may not be able to clean themselves on their own assistance and may not be able to do it, or may just not feel comfortable doing it on their own. They may still be able to bathe and get their hair, but they may not have the assistance to be doing it safely on their own, or just don't feel comfortable with it. So the personal care is your hands-on. It's your showering, maybe putting some lotion on their feet, maybe washing their hair, doing some sort of massage on them. It's all of that hands-on. And your caregivers that are doing some of these are all going to be different, and I'll kind of talk to you about that as well. There's also a companion service, and companion is just sitting there and having that one-on-one conversation. It doesn't not entail your personal care or your homemaking, but it's sitting with that person, playing cards with them, listening to a story or two, reading to them. It's just that one-on-one interaction, friendly visits, I guess you could say. Some of our clients that we work with companion we do go into nursing homes for some of our private pay clients, and and they're just sitting with them. You know, they go out, they bring them down to the dining room and just have that personal interaction. It's just an extra set of extra set of eyes on that person as well. So the companion is just that friendly visit. And then of course we have respite. And respite is respite relief, which basically when there's a caregiver in the home and the client or the loved one cannot be left alone in the home, someone is able to come in, do all three of those services. Whatever the caregiver might normally be doing in the home, it could be companion and sitting with them, it could be laundry, and it could be giving them a bath as well. Whatever the caregiver would normally be doing, the aide or the company would be able to provide for that person. So it gives the caregiver a break, gives them respite relief, gives them a time to get out of the home, go take a nap, go get your nails done, go get your hair done, whatever. And you know that someone's there and caring for your loved one during that time. Of course, that time is very important. It usually means that loved one cannot be left home alone. So it just, you know, we will come into the home, the caregiver would open up the door, they can leave for a little while. And when that caregiver comes back home, that's when that staff member would be leaving and kind of, you know, just giving that break to the caregiver. So the respite relief is just more of a caregiver resource for them. You know, there's several different staff members that you have. So you have your homemakers, which are, like I mentioned, just someone who could do companion care or homemaking services. And typically that is an aide who just has a little bit of cleaning experience. They may have some experience with
Could
working
you
with
give me that what was after respite relief? Because I got a phone call. It just rang. I stopped it immediately, but
That's
I didn't
okay.
hear the title of the next one.
Yeah, so let me just kind of touch base. You've got the homemaker, which is the
No,
cleaning and
I wrote them all down. What's the
okay,
one
so
after respite relief?
as for respite relief, I was just going through what the different caregivers might be, like what the different aides might be that might be coming into your home. So
Right.
the homemaker and the companion is usually done by someone who has a little bit of experience as cleaning around the home and possibly working with seniors. They don't necessarily have a CNA license or a home health aide certificate, but most companies, almost all companies that you're going through or that are out there in Brevard County that we work with are background and trained in working with seniors. So they're level 2 background fingerprinted staff members that have some experience working with seniors. Anyone who does hands-on, that respite or that personal care is done by either a CNA, which is a certified nursing assistant, or an HHA, which is a home health aide. So you have your CNA and your HHA, certified nursing assistant, and your home health aides, and they have a certain amount of minimum hours. They have either a certificate or a license to be able to perform those hands-on services with them. They just go through a different training than what your homemaker or companion sitter might be, because the homemaker and companion sitter can't lay hands on your loved one. The CNA or the home health aide can. Let me see, kind of, you know, I mean, I went through the CNA. You have your private duty nurses, you know, and these are all just different types of assistance that you can get in the home. The things I just mentioned were your in-home care, your home health aides and your home care programs. You do have private duty nurses where they are LPNs or RNs that can come into the home and help with medication administration. They can help with more nursing and more in-depth. They have the extra level of education than what the certified nursing assistants have. And they do a little bit more clinical. They, you know, if someone has lymphedema, they could help with lymphedema wraps on their legs. Like I said, medication administration. They just have more training and more background than what the certified nursing assistants or the home health aides have. Of course, hospice is always a can be a little bit of a scary word for a lot of people, but it's once you get to understand what hospice is and the actual wonderful support that it provides, it's not as scary. Hospice can be a wonderful service for anyone who has a debilitating disease, an end stage disease. And it doesn't mean that that person's going to pass away in, 4 to 6 months. People can be on hospice for years. It's not, and they provide social support for the family. They provide a ton of different medical equipment for the family and the client as well. And just a ton of different resources are out there under the hospice program. And typically it's covered under the insurance. And we'll kind of go through that at some point when we get to that.
Let me back in here for just a second, Deborah and Allie and Kara. My dad was on hospice for more than 2 years, Deborah. I think it really, and
My
Allie,
mom,
what's that?
Yeah.
So, so it's not necessarily this, you're not necessarily gonna, have to have, Allie's right, you have to have it be, a 6-month thing or a 3-month thing or a week thing. That sort of, hospice has evolved past that. And it's an extraordinary resource. I think it really has to do with your mindset as to, how we're going to deal with how we, as the person who's got the debilitating condition and their loved ones, how they're going to move forward with it, and whether or not, and what kind of treatment things they're going to be doing, and whether or not they've made a decision on those things. With my dad, he had Parkinson's and he also had lymphoma, and they weren't going to be treating it. And so because of that, and because he was continuing to decline, he qualified for hospice, even though we checked and nobody has expiration date on their feet. And we didn't know how long Dad was going to last, and he did last a couple of years. So in any case, that's my 2 cents. I'll go back on mute now.
That's right. And I think, like I mentioned, hospice can be covered, and in hospice as well as therapists. We talk about, so your dad is going to be coming out of rehab at some point. The biggest thing I always want to strive for, because I've worked in the social services department before in rehabs, is to make sure you find out that the social worker or the discharge planner, whoever's going to be doing that, is going to set him up with some therapy and skilled services coming out of there. And that's your physical therapy, your occupational therapy, your speech therapy, possibly, depending on any diagnoses that he has, as well as that nurse, that skilled nurse coming in, helping with medication administration, doing education. I always kind of word the physical therapist and the occupational therapist as being kind of defined. Your physical therapy is your top of your body, or is the bottom of your body, and the occupational therapy is your top. Your physical therapy is your walking, your ambulating. And your occupational therapy is those fine motor details. You're eating, you're dressing, you're combing your hair, you might be brushing your teeth. The occupational is just those fine motor skills. But Medicare will cover that. So keep that in mind, that when he does get discharged, to ask the discharge planner or the social worker, what about therapy? Am I going to be able to get therapy in the home? That will give a little bit of a break as well, because you'll know that someone will be coming in the home. It doesn't last forever. It could last 4 to 6 weeks, sometimes 8. It really depends on the goals that are needed. If he's going to be living alone, the goals will be more involved than it might be if he had a caregiver in the home. So stress those conversations and have those conversations with those discharge planners of, he's going to be living alone. Yes, I'm going to be here for a week, but I'm going to be going home, or whatever the scenario might be, because the goals are going to be different. And it may mean that he's going to have those therapies coming in a little bit more frequently, 2 to 3 times a week for maybe 6 to 8 weeks. It really depends on what the needs are. But I would definitely stress that, to talk to them about skilled services in the home.
okay, thank you.
Yeah, absolutely. And, And the Medicare, like I said, Medicare covers skilled care, that nursing and therapy, just like they're doing for a portion of it over at the rehab. Traditional standard Medicare covers so many days in the nursing home for so much percentage. Usually it's 80% for the first 20 days, and then they cover only a portion of that after that. And that secondary insurance might pick up after that. Similar to that, that's what they do in the home. Usually Medicare will cover for that nurse and that physical therapy to come in for a period of time. And it also covers hospice too. So depending on the diagnoses of your dad, kind of keep that in mind with hospice. That's a conversation to definitely have together, or any of you guys as children coming together and see what works best for you and your family. All of the services I've talked about too, the in-home homemaker and the personal care and the companion, and the respite, most companies can either do you can pay for it privately. Sometimes if he has a long-term care insurance, like a New York Life or something of that nature, sometimes they cover a portion of it. Do you know if he has a long-term care insurance, or is he pretty much on?
I would say no.
Okay. And, sometimes they do that. We just don't know, or maybe there's a portion that covers, that was one thing I remember when I worked in the nursing homes, is asking my parents and saying, do you have some sort of coverage, or can you afford to do it when you come home? Because it's a tough ball game when they get home and they need more care than what they did before. Aging Matters does have different, we are a nonprofit organization, and we get different grants and funds for a lot of our services that we provide to our clients. So, the sooner the better. If it's something that you think that dad may need a little bit more assistance in the home, getting on that program and getting on our funded programs is better sooner than later. Grants and monies run out, and, we go through a period of time where we're able to open up clients, and then we go through a period when we can have to halt back and not have the ability to open clients. But we always strongly encourage getting on that wait list for the services, to be able to have a personal care attendant or to have a homemaker in the home under our funded programs at very little or no cost. Is best to get on that wait list sooner than later. So, when we can definitely get you the information, and it's a fairly simple process. They do a screening over the phone and go through a process of a period of questions and get on that wait list for the in-home care. But most insurances do not cover those homemaking and personal care. It's usually under a private pay, or through different grants or funds that maybe a particular company has, like Aging Matters. But a lot of them, you either have to have a Medicaid plan or a long-term care insurance to cover it, and it depends on the Medicaid plan. Without going through a super huge long rabbit hole, it does. You can always reach out to us, and we'll kind of help guide you through that process. But I kind of went through all of the things that I think are available in the home at this point. The physical therapist and the occupational therapist will be coming out. When they come out to your home, and like I mentioned, make sure you talk to the discharge planner and the social worker about it. But you really want to double check, because they're going to be looking in the home and seeing what safety hazards there might be. Are there throw rugs on the ground for you to be able to have pulled up? Or do you need grab bars? Do you need a shower chair? Do you need, they're going to go through that process and see what is going to be safe for your father to return back home and to live independently. And most of the time they're very honest, and they'll say, you know what, this just might not work, and we need to think about alternative options. And those therapists are there to help make that decision a little bit easier for you, because they have the experience and the knowledge behind them to make not make the decisions, but give you understandings about what it might be like to live at home safely or unsafely. And that's kind of where Kara likes to jump in and go from there, is to kind of see what other options are if you're not going to be in the home. I know,
Okay.
Deborah, I threw a lot at you. Do you have any
Well,
questions?
no, I'm not unfamiliar with this, only in the sense that my mother, who had a massive stroke, was in nurse rehab and then a nursing home for a year and a half.
Mhm.
So I've seen a lot of this take place outside of the home,
Yeah.
and I'm sort of familiar with. I'm also a licensed clinical social worker, so I know a little bit too. But bringing him to the home, I'm finding that, he is declining and he's going to need, some days he can feed himself, and other days his cognitive functioning is so low that he needs to be fed. Sometimes he can clearly speak and he's lucid, and other times he's delusional and confused. I'm pretty sure he's going to need someone to change diapers and some really heavy duty stuff, which I haven't seen mentioned here. Is that correct?
That would go under some of the personal care. Yeah, they can. We've got a lot of clients that do need with changing briefs and
Oh, they can. Personal care does that?
yeah. Yep.
Oh, okay.
Yeah, they do. Of course it's really, that's something you might want to think about too, is the duration of how much care is he gonna need, because then it goes to most of the in-home are not, there are some companies that do long-term 24 hours a day or 12-hour shifts. Aging Matters main thing is usually about 4 to 5 hours at the most a day, and it's
I'm
not
gonna
like a
need-
huge
yeah.
through the funded. Yeah.
I'm gonna need 20. They tell me 24/7.
Yeah. And just kind of give you a rough estimate, that definitely is a lot of times a heck of a lot more expensive than it would be to go into an extended care unit, whether it's an assisted living. I mean, the in-home help on a 24-hour basis, you're probably looking at, correct me if I'm wrong, but $10,000 to $12,000 a month. It can be a little bit more than that.
That's how much it was for my mom at the rehab.
Yeah.
And it wasn't it wasn't like the top of the line rehab either.
Yeah.
So the guardrails on the beds, can you start out with that and then see if you need like a hospital bed? Like, can you play it like that?
Well,
You could.
I'm going to bounce in a little bit there, Deborah,
Yep.
because I will say that most of so the guardrails that I'm familiar with, just be careful that they're adult guardrails. A lot of times you get these guardrails and they're really for kids. They're for babies.
No. Yeah, no, I would, yeah.
Yeah. And
I was
hospital beds have guardrails that I think are more that tend more towards being able to keep, an adult, your case, maybe an adult male,
Yes.
able to be in bed. Most of the bed rails that I have at Sunflower House are really meant not necessarily to keep folks from rolling out as much as they are to assist people to get out of bed, because there aren't any arms on your bed like you would have on a chair. So you use it for leverage. But bed rails, portable bed rails, I would just be really careful with those, Deborah.
Okay.
And I know that hospital beds work a little bit differently in Florida as well. They may not have full, and I think a lot of families get upset too, is because the hospital beds don't necessarily come with full bed rails anymore.
Right.
They only come with quarter bed rails. So it's up near their heads. They're not full extension all the way down. They only maybe go to their shoulder, but the hospital bed is nice because it helps with the assistance of getting up and down. A physician can order that depending, there's some some guidelines that need to be written in the order, and there's some diagnoses that may need to have to qualify for a hospital bed, but the physician and the discharge planner might be able to help with that. And then also on that flip side is depending on the diagnoses too, that's where a great resource that hospice jumps into. They can load you up with all the supplies you possibly need.
Oh, I know. I've seen them. They gave my mom the most beautiful wheelchair.
Yeah.
It was like a deluxe wheelchair.
Yeah.
So, yeah.
So, Deborah, if it would be okay, I'd like to have Kara speak just briefly on the different options that are out there,
Absolutely. I just had to
you know,
say a few things.
yeah.
Yeah.
So looky there, can you see my screen?
Planning to have senior living options.
Well, either you're really good or you can see it. Or
I
you
can see
studied
it.
ahead. Well, Deborah, this might be a little bit starting for basics for you because you've moved a few steps into this particular plan. But starting with the very basics may be something for you to kind of step back and consider, or certainly anybody who watches the recording of this particular presentation. One of the things that I like to start with is letting you know just kind of a brief overview of where we're going. So you might find that you are in one of these steps, knowing who pays for everything. What are your goals? Like Ali said, there's a lot of resources for you to bring into the home, but not everybody's appropriate to stay at home, or maybe they can't do so safely, or they don't have the financial resources to be able to do that. And while I don't tell anybody what they need to do, I do like to let them know what their options are for sure. I've learned over 25 years, I don't tell anybody that they have to leave their home. I didn't even tell my grandmother that, so I'm not telling anybody else's parents that they have to leave their home. So knowing who pays, understanding that your medical insurance doesn't cover the cost of medical care beyond acute care stays. Medicare doesn't cover the cost beyond acute care stays either. It does pay for the home health care that Ali was talking about, that physical, occupational, and speech therapy. It covers doctor's appointments. It does not pay for room and board or care at assisted living facilities. Those are just some examples. That's certainly not an all-inclusive list regarding Medicare. And I've listed a website there for you if you want to go and look what the specific benefits are. Not everybody's familiar with the benefits of Medicare.
What's the website?
Sure, it's medicare.gov, G-O-V.
Oh, okay. I saw that. I didn't think that was it. Okay.
Okay. So Ali had mentioned long-term care insurance, which was a great purchase for some folks. In fact, a lot of folks actually forgot that they purchased long-term care insurance and exactly what it was for. But this is exactly time to get it out, take a look. What does it cover? Some policies cover everything from private duty home care through assisted living, skilled nursing, and even hours of what's called geriatric care management. We have our statewide Medicaid managed care program, which is, as it says, essentially the privatization of our Medicaid system. And it's best to seek professional assistance when you're going through that particular application process. It's good to know what finances impact your eligibility. And there's a website listed there. Deborah, if your dad's a veteran, he may be eligible for a veteran's benefit called VA Aid and Attendance. And that website is listed there. And that is for certain veterans during who have served during wartime. I encourage
I'm sorry, Kara, I'm going to bounce in a little bit here. Deborah, I did a caregiver conversation with a person, with a lawyer here in Brevard County, who is Amy B. Van Fossen, who on VA aid and attendance. So if your dad was serve during conflict, we can, you should check out that conversation.
He is not VA.
Okay. But for those who are, certainly, Beth, that's an excellent resource. Amy Van Fossen also gives free seminars so that you learn what the qualification criteria is, and then she'll talk with you further if you feel like you're eligible. So knowing your goals, specifically for you, Deborah, and your dad, what's most important to your dad, and not allowing the fear of change. Things are different from before he left his home to go to rehab until now. So not being afraid of that change and not letting others pressure you to change what it is that you desire. What are your goals? Just because other people don't think it's a great idea doesn't mean it's not a great idea for you. Everybody can tell you why it's not going to work, but if it's your goal and you've set it up to work that way, then work your goal. And certainly empowering yourself with knowledge, knowing what your insurance coverages are, what your finances are, what you can afford to do, understanding the diagnosis and what's coming down the road as far as an additional need for care, having all those advanced directives in place, knowing who's the power of attorney, living wills, the do not resuscitate order status, knowing all of those things. Those are kind of bummer conversations. Believe me, I know my family knows that I'm kind of the, do you have your advanced directives, girl? Which doesn't exactly make me the life of the party. But these are all really important things to talk about with your family. And understanding what their desires are really helps you in the long run. It puts you in a power position and not having to be concerned that you're making the right decision. Who helps you achieve these goals? More specifically, who is in your circle of concern? And I utilize this particular expression. I've borrowed it from an author who I credit at the end of the presentation. And it's really all the people who are involved, Deborah, in your dad's care, or someone else who's watching this recording in their care or the care of their loved one, your doctors, your neighbors, friends, family, everybody who even has an opinion on what's going on with the loved one who needs care. All of those folks are within the circle of concern. I would encourage anyone who lives out of town like you do, Deborah, who has a parent who is aging and is a little bit out of your geographic range to consider.
I'm going to be living in the house.
Oh, you're going to live with them. Very good.
Yeah.
Very good.
Yeah.
Even if you're in town, it kind of becomes a full-time job, and it's a full-time job that you didn't get any training for other than, it's one of those situations.
When you said, do not allow fear of change to play a role.
Yeah, it's tough. Listen.
Here I am.
It's very, very difficult. I do encourage families, like I said, that live out of town, but even yourself as you come in to a new role and being your dad's caregiver as well as his daughter, to consider what's called care management or case management. And those are folks who are going to come in and help you create a plan that works with your dad's needs and your budget. And if the goal is he wants to stay at home, I mean, who doesn't want that? My grandmother said, you're taking me out feet first. I am not leaving my home. Well, okay, we just have to figure out how that works, right? So we have to look at the cost of that happening. What services are available? Is it safe to do that? What family is available to be involved? Deborah, in this case, you are. Physicians, the community, access to friends. Is it the best choice for them socially? Are they going to become isolated in the process of staying in their own home? All of those things can be considered with the help of a case manager. And then as the situation changes, that case manager comes back to you with a different plan, with a revision to the plan, with an addition to the plan, understanding that your plan is fluid and that it's going to change. But you have to look at this in consideration of your finances and what your goals are, because not everybody has the ability to age in place at home. As Allie mentioned, those private duty services for 24 hours a day, they're really more like 12 to 15,000.
That's what I was thinking.
Yeah, or more at this point. So sometimes financially, not everybody can do that. And you may try that at first. And
what
you
about
run that
12
plan.
hour? What about 12 hour? What about
it's going to be about half of that.
It'll be half
12 hours a day is going to be about half of the 15,000, but then you need a plan for the other 12 hours, right? As we know, every day has 24 very long hours when you're a caregiver. So having a case manager who helps you come up with a plan, they can come back to the table with a new plan based on your new situation and your new financial choices. Who pays for that case manager? It is a private pay situation. So if it's not out of pocket, it might be covered by a long-term care insurance policy. And then if you are employed, a lot of employee assistance programs the EAP for your company may cover the cost to speak with a case manager a couple of times. So it's worth looking into if you are employed and have an employee assistance program available to you. You can find a care manager in any area by going on aginglifecare.org. Of course, if you wanted one in Brevard County, any of those folks in these squares can help you with that and find somebody for you here locally. That'll be super helpful. Knowing your options in home, private duty. Allie went over that very, very specifically and extensively. Just so you know, private caregivers are ranging from about $18 to $24 per hour. Right now, I got that from a friend of mine who owns a private duty home care agency. Going through an agency, in my opinion, is always better than a friend of a friend or someone you met at church, because you always want them to be licensed, bonded, and insured. And going through an agency ensures of that. You want to know, as part of your goal, what do you need them to do? Do you need them to just sit there and provide companionship, or do you need hands-on care? Because someone who's going to assist with the bathing, grooming, dressing, and toileting, as you had mentioned, Deborah, that person's going to be a little bit more expensive. And of course, we don't ever want our private duty caregivers to be responsible for any fiduciary duties. That sounds obvious, but don't we read about it? Any fiduciary duties, anything financial?
Right. Okay. Gotcha.
Yeah. And I know that sounds obvious and we all kind of go, well, duh, but we read about it in the paper all the time. And it was as simple as handing somebody a debit card to go pick up groceries, right? It was just that one time. So, and then that's gone. And that's unfortunate, but it happens. So what are your goals? If you're going to have that private duty caregiver in, what exactly do you want them to do? How many hours per week will that take to do that? And does it meet all your needs, including the safety of your loved one? And I always encourage contacting multiple agencies to get pricing and to talk to them about who they have available. If it's shorter hours, I always tell folks, if you're going to ask for 4 hours, 3 days a week, don't expect to see the same person 4 hours, 3 days a week. It's really hard to staff consistently in those smaller hour blocks, because those caregivers are also working to pay bills. And if they take a 4-hour case, it takes them out of the possibility of making more money. So that's just a reality. And I just like folks to be aware of that. Who pays for private duty care? Private, it comes right out of your pocket, unless you have long-term care, that VA aid and attendance policy, or you have the Medicaid program, which Allie mentioned through Aging Matters, they're limiting to about 5 hours a day. And I don't know if that's through Medicaid or your grant programs. Medicaid typically limits to about 12 hours per week.
Yeah, and our funded programs are, our average plan of care is, if someone needs homemaking and companion, or homemaking and personal care, is usually homemaking is about 2 hours 3 times a week, and then you've got your personal care about 1 hour to 2 hours 3 times a week. So similar to what the Medicaid, you're anywhere between 12 and 15, maybe 20 hours a week. We do through our funded programs pay, and some of the Medicaid long-term care do as well, but pay for adult day centers. Mm-hmm. So in some of those, you have a little bit better of an option of being at those adult day centers for 40 hours a week than getting the in-home for 40 hours a week. It's very rare to have in-home care covered through the funded programs or Medicaid for 40 hours a week. I don't think I've ever seen it.
Sure.
But adult daycares, because usually someone needs to go to work, or, and that's typically a reason why they need the adult daycare as long as that. But adult daycares are a great option. It's another wonderful stimulation, respite relief for the caregiver, and they're around others in a social setting, and still provides bathing at times as well. And it's a good option to still be at home, but getting that extra stimulation outside of the home.
You're exactly right. And Medicaid's going to go for whatever is the least expensive. So if 12 hours of care per week is not enough to keep that individual at home safely, then Medicaid is going to recommend the next level of care, which could be adult daycare, if that's appropriate. And then, of course, moving on to assisted living or long-term care in a nursing home. Independent living. Independent living can range from sliding scale rent. We have some of those facilities in our area for low income seniors to, I think it says $4,000 a month. My face is right over the number, so I hope it says 4,000. Amenities can affect the price. Of course, when you got that super nice swimming pool and the full bar in the lobby, it's going to be a little bit more expensive. Sliding scale rental communities often have a wait list. So it's really important if you think that that applies to you or your loved one, you want to plan for that and go ahead and get on every waiting list in the county. They do not offer services, but they do allow for services to be brought in. So if somebody needs a little extra personal care assistance, they can have that brought in through private duty or home health. Meal plans, some offer, some don't. And then typically they do have organized social activities. Assisted living can cost between $3,000 to over $6,000 per month. Brevard County is creeping up into the $7,000 territory as we speak. Who pays for assisted living? It's totally out of pocket. Medicaid pays if you are a beneficiary, but they pay for care only. So you still have the shared cost of the room and board. Long-term care insurance has typically a daily rate that they will reimburse. And then the VA aid and attendance benefit can apply towards assisted living, but it certainly does not cover the total cost of assisted living. Knowing which assisted living facility is right for you is a matter of going and looking at them. Certainly go to several. They're going to vary even within a specific price point. They're still going to be very different between each. And you may want to add the staff of your circle of concern, people that you can call and ask questions. And certainly somebody like me who's able to offer insight and knowledge is always helpful. And my services are free. So keeping in mind with a lot of folks, free advice is worth every penny. Looking at professionals and asking for their guidance and advice sometimes helps give you a direction or maybe helps you solidify the direction that you're already going. Skilled nursing facilities, also known as rehab, where Deborah's dad is right now, or a nursing home, as it's been referred to, can cost between $6,000 and $12,000 plus per month. If you're there for skilled care, Medicare is going to pay for that on a limited basis, as Ali already discussed, along with the medical insurance for a limited period of time. Long-term care insurance is often able to cover if you're there for a long period of time and you're paying privately. Of course, you can pay privately. And then the Medicaid managed care, which is pretty limited in nursing homes. They really want everybody to be in assisted living if at all possible. And a skilled nursing or a nursing home is not just for end-of-life care. As you know, Deborah, is for when there's a medical event and you need to go in and get a little bit of short-term rehab, hip fractures, knees replacement, post-stroke, cardiac care, lots of reasons that folks at any age would require some rehabilitation. I don't think I should say any age, right? I think there's actually a senior element to that typically. But if your insurance covers it and you have a knee replacement at 55, I think you can go to rehab as long as your insurance allows for that. As I mentioned, my book credit for Circle of Concern, I do like to mention my good friend. I call him my good friend. That might all be in my head. I met him once. Dr. Dennis McCullough, who wrote the book, My Mother, Your Mother. That can also apply to a father, Deborah, if you read this particular book.
I figured it could.
It's a fantastic read for anybody who's caring for a senior parent. It really is a transition in your relationship to go from being the child to being the adult. And that can be a little bit trippy. We're all social workers here of various degrees. I think I'm the biggest slacker of the group because I believe Ali is master's prepared and we got an LCSW. So anyway, Dr. McCullough is a great read. If you're looking for just a little extra guidance, he's got a really great head for that. So I just say thank you. That's my contact information, Deborah. If there's anything that I kind of breezed by a little too quickly or something you want to follow up on, you are more than welcome to give me a call at that number.
Thank you.
Anytime. You are so welcome. Or anyone else. I'm trying not to refer just to Deborah. I know that there's going to be other people watching the recording. So anybody who has any questions is welcome to call me at any time. And now I'm going to return the screen, I think, to, nope, that didn't do it.
Now you go up to,
I'm giving it back to you.
more. Yeah, you give it back. Thank you very
I'm
much.
giving it. I think I'm giving it back.
That's okay. You got it. You did it perfect. Deborah, do you?
This is so stressful.
Oh, we're all so new at this stuff, Deborah. I think we all need 14-year-old boys in our closet. Ellie, you have a couple of those, don't you? That we could just borrow and stuff in our closet for tech.
Exactly, for tech help.
I don't think we're allowed to say that, Beth.
I know. It's, yeah, it could be a little creepy. Yeah, I know. Deborah, do you have any questions? Any more questions or anything else I mean, you might have stuff that comes up later in your head. But is there anything right now?
I'd like phone numbers that I can call if something comes up. Is that all right?
Sure. Well, yeah.
I have
Do we
Kara.
want to put it in the chat? Will the chat stay up if we video it? Like, does it?
I'm not sure. Yeah, put it in the, go ahead and put it in the chat and we'll see what happens.
Now,
Get mine, Deborah.
what is your name talking right now?
Me?
No,
Me?
the lady who was just talking.
Beth.
Beth?
Yeah.
You're Beth. Okay,
Yes.
so you're the one I first contacted, correct?
Yes.
Okay, I have your information. I have
Cool.
your phone number and email, so
And
that's
then
good.
Ellie just put hers in a chat with her
And
phone
there's
number.
Allie's. Great. Okay, I've got everybody now. Thank you so
Perfect.
much.
Good.
Perfect. And Deborah, this workshop actually has 4 weeks to it. So
I saw. I took a
I know,
picture
so
of.
next week, actually, Ellie helps present again next week, and some of the stuff we'll be going over again, but we'll also be talking about home modifications in next week's section.
Good.
So thinking about and Rose is she does a spectacular job with all kinds of things that you don't even think about that you need to think about when you're going to bring your dad home, as far as what needs to happen to be able to bring him home safely, and what, sort of like when my grandchildren visit, I mean, I don't have the closed latches on my cupboards or the surround around my pool or those sorts of things, but I've got a 2-year-old grandson. So when he comes to visit, and I'm keeping my very positive thinking cap on, I'm going to need to look at all those pieces. And very much the same sort of thing happens when you bring a mom or dad home to live. How we live now is not necessarily what's safe for somebody, like you said, the dad's in his 90s. So I'll be sending you in the next couple of days. I will send you the Zoom link for next week's next week's session, Deborah.
Thank you so much. I took a picture of it at the mall. You had a picture of the schedule. So I kind of know what the topics are going to be. So I mean, I've appreciated this so much. It just, it gives me some insight.
We're so happy we are so happy you did. And this is exactly what Aging Matters in Brevard and organizations and companies like Simplifying Senior Living and Sunflower House specifically, that's what we're here for. Sunflower House is for caregivers who are looking to care for their loved ones, primarily in their home. But, you don't stop being a caregiver if you have to place your loved one. I think that's something that people don't necessarily think of. But I know specifically with my mom, when she was caregiving for my dad, it didn't stop when she put dad into the nursing home.
Oh, my dad visited my mom twice a day.
Yep.
It took a toll on him physically, and it took a toll on me. I mean, I was here often too. And the whole thing, you're absolutely right. And at least we're going to give it a try. If it doesn't work, we can revisit it. But right now, everyone thinks Papa should be at home.
And I personally, I think that's, everybody has to make their own decisions. But I wish I would have, are some of the hardest words we ever have to say to ourselves. And to know that nothing is really written in stone, Deborah. You can always have other options. You're not necessarily, because you're deciding that you're going to try it at home, doesn't mean you're closing the door to other options. So just,
Exactly.
like Kara and Ally both said, keep exploring options. I would seriously suggest that if you are thinking about some of these things, is to maybe get on some waiting lists, because it doesn't hurt. You can always say thank you, no thank you. But you might want to consider some of the waiting lists just to get your dad's name on them.
That's
Because
not a bad idea.
some of them can be pretty long. You're not talking weeks for most part. You're talking months for a lot
You're
of some
talking
waiting
about
lists.
long-term care.
Yeah,
You're talking about long-term care, right?
yeah. Well,
Yeah.
Some of them, yeah. There's I'll shoot me. Well, I can give you a couple numbers here anyway, but some of the best option is to reach out to us. You can reach out to me, and I can make the connections for our funded program for you. You would
Okay,
do a screening with Lori, our intake specialist, and then she can divert you to reach out to Senior Resource Alliance, which is our they kind of manage some of our funding for easiest way of terms. So kind of oversee some of our funding, and they work with us on our different funding and grants that we get. So they would kind of walk you through the process of the more longer term funding, like Medicaid long-term care or the managed long-term care, and they can get you on that wait list as well. So just reach out to me, and I'll kind of link you up with the funded program resources, as well as the managed long-term care.
So Medicare pays, they don't
Medicaid,
pay-
it's
Yeah,
no, it's a
Medicaid,
managed
that's what
Medicaid. It's a
I-
managed,
Yeah.
long-term care Medicaid managed
Yeah,
care.
Yeah, okay, I understand. All right,
Yeah.
well, I thank you very much, and I thank everybody a lot. I thank you, Deborah, for
Yeah.
joining, and Ally and Kara for your wisdom and expertise. And I look forward to seeing Deborah and Ally next week. And Kara, you're always welcome to mention. We didn't even see your kitties this time too much. Kara has kitties that you.
One's
Oh,
right behind the
my
screen
goodness.
sleeping. If you wanna- She's
Oh,
being very good.
Oh, there she
that makes
is.
me feel better.
Been an angel, which is shocking. So let's all just
She's sleeping.
It's a tuna fish for dinner, Kara.
try.
I thank everybody so much for the day. Y'all
Thank
have
Thank you.
Thank you all.
Bye bye.
Bye-bye.